So here's an example of a relatively unique diagnosis, but one that I think may allow you to make a very specific diagnosis in a certain subset of patients. Now, as you can see on these T1 post-GAD and T2 weighted images, there are innumerable tiny cysts scattered throughout both kidneys. Now, interestingly, notice how these aren't within all of the renal parenchyma, but rather all of these little tiny cysts, which measure 5 or 6 millimeters in size, are all clustered right at the renal cortex. This was actually a patient who had a very unique history. This patient had a history of chronic lithium use for a psychiatric disorder and had known lithium nephropathy. And this is exactly how they can look. Classic lithium nephropathy, whether on CT or MRI, will present with innumerable tiny cysts along the renal cortex, right at the surface of the kidney. If you see that, the first thing you've got to do is look into the patient's medical record, see if there's any history of lithium use, and if there is, you can make the diagnosis of lithium nephropathy.